Identification of the MST1 protein's role in the Hippo pathway and its application to colorectal cancer. Colorectal cancer, or CRC, is a cancer affecting either the colon or the rectum. In the United States, it is the second leading cause of cancer death in both men and women. But fortunately, the survival rate of colorectal cancer patients has been improving thanks to developments in diagnostics and treatment. However, there are still developments that can be made to catch the cancer early, which is especially important for CRC patients, who often don't show symptoms until the later stages of cancer. In fact, 60% of CRC deaths could be prevented with earlier diagnosis. Scientists have been studying possible biomarkers that could be used as a tool to help clinicians diagnose CRC in the early stages, and recent studies have found the MST1 protein, shown here, to be effective for diagnostic use. In this video, I will talk briefly about the Hippo pathway, which MST1 plays a role in, and discuss the effectiveness of the protein as a tool in the clinical context. Cancer is caused by the abnormal growth of cells, so the body developed pathways to regulate cell growth. One such pathway is the Hippo pathway. This pathway plays a critical role in controlling cell growth and proliferation, apoptosis, and organ size. Without it, cells would grow rapidly to form huge Hippo-like masses, which often become cancerous. The Hippo pathway is a protein kinase cascade. A kinase is an enzyme that adds phosphate groups to proteins, and a cascade of these kinases results in phosphorylation of proteins in a sequence, which can only result from the phosphorylation of the previous protein. In the Hippo pathway, we begin with the phosphorylation of MST1 and MST2. This triggers the phosphorylation of WW45 and then LATS1 and LATS2. These two proteins then enter the nucleus and trigger the phosphorylation of YP protein kinase, a protein kinase that is known to activate certain genes to promote mitosis. The phosphorylation of the YP protein kinase causes it to become inactive and prevent the transcription of certain genes. In the case of CRC, the pathway is disrupted by lack of MST1 protein kinase, preventing phosphorylation of subsequent protein kinases and ultimately causing the YP protein kinase to remain in active form, which results in abnormal cell growth and therefore organ size. We can see the physical consequences of lack of MST1 protein kinase expression in this image of the intestinal tract from mice with and without the MST1 gene. The left side corresponds to a mouse with lack of MST1 expression, and the right side corresponds to one with normal MST1 expression. Here we can clearly see a visible difference in the size of both the stomach and the cecum, with the intestinal tract of the mouse with no MST1 expression having a much larger stomach and cecum. Thus, the MST1 protein plays a key role in regulating organ size. On a more microscopic level, the left image shows the small intestine epithelial cells in healthy control mice with normal levels of MST1 expression, and the right image shows the epithelial cells in mice without any MST1 expression. Notice that the right image has cells that are significantly disorganized compared to the left image. This demonstrates that low levels of MST1 expression facilitates abnormal cell growth and lack of cell differentiation, which corresponds to the abnormal size of organs shown in the previous image. Studies have found identical trends in humans as well, where MST1 expression is significantly lower in CRC patients compared to healthy control patients. This finding is supported by the results of a Western blot, which detects the amount of a specific protein present. The graph on the left clearly shows a lower level of MST1 expression in CRC patients compared to healthy controls. Moreover, researchers found that MST1 concentration continued to decrease as patients progressed to later stages of cancer, which is indicated by the plot on the right. This suggests that the protein could be used to track the progression of colorectal cancer. Other biomarkers are also used in the diagnosis of CRC, like the carcinoembryonic antigen, CEA. However, studies have found MST1 to be more sensitive and accurate in diagnosing CRC. The left graph shows the sensitivity and specificity of using only CEA to detect CRC, and the right graph shows the results of including CEA in a panel of biomarkers used to detect CRC, including MST1. As we can see, there is not a significant difference in the blue curves, indicating that adding CEA to a panel of biomarkers, including MST1, does not significantly improve the sensitivity and specificity of the detection of cancer. Colonoscopies are also used to detect cancer and have proven to be accurate. However, this form of diagnostic is often more costly and poses an inconvenience to patients. In comparison, MST1 expression can be measured by isolating serum, a protein-rich component of blood, which can be obtained through blood draws. This method is much quicker and easier compared to colonoscopies. All of this study about the effectiveness of MST1 as a biomarker and its benefits over other diagnostic methods like colonoscopies suggests that physicians can measure MST1 protein expression levels to detect CRC at its early stages using blood draws. Then, treatment can begin much earlier and potentially improve the overall survival of CRC patients.